Hi there, I'm Aaron Snyder back with a new diabetes prescription. We're talking about prescription number 4, which is exercise is the best medication. I can cite you study after study that talks about how blood sugar is better controlled, blood pressure, blood cholesterol, insulin sensitivity is increased, insulin resistance is lowered. Talk about all these benefits of diabetes and blood sugar from exercise. Proof is in the pudding though. I used to exercise, and I talk about this in the introduction of this chapter, with a man named Eric, who is a medical doctor. He is a diabetic who got his type 1 diabetes through cystic fibrosis, and we would be exercising, lifting weights, and checking our blood sugars because we were constantly getting hypoglycemia during our workout sessions. Really low blood sugar, 40 milligrams per deciliter, pass out time. That's how powerful diabetes control can be when you're exercising. On another note, Eric noticed that he needed less than half the amount of insulin for a man of his body weight and activity level when he was exercising rigorously. So even if you have type 1 diabetes, exercise can reduce the amount of medication you need. Now remember, with type 1 diabetes, insulin is a must. You have to take it. Otherwise you die. It's that simple. Even in type 1 diabetes, we can drastically reduce the amount of insulin that we need to take, the amount of medication that we need to take. And the better news is that with type 2 diabetes, we don't have a forced to take medication stigma on ourselves. We can, if we lose enough weight, we exercise enough, we treat ourselves well enough, get off all or nearly all of our medication. Now that's a godsend right there, especially when you consider nowadays that medications, the cost of them are on the rise, health insurance is getting poor, medical insurance is getting more costly, healthcare is costing us more and more. It is a godsend that we can afford to take care of ourselves in such an easy manner with a copay of exercise which costs $0 a month. So that's what we're going to be talking about in this chapter.